This is an ultrasound case of 42 years old male patient. His chief complaint is congestion of his face and eyes and neck. Here we see congestion of the internal jugular vein in the right side by transverse section. Here is a longitudinal section of the right internal jugular vein. We don't see the abnormal variations in diameter with respiratory cycle and cardiac cycle which occurs normally in the internal jugular vein. This confirms that it is abnormal. Here is a comparison between the two sides by longitudinal section. Here is a comparison between the two sides by transverse section. The thyroid gland is normal. Internal jugular vein, longitudinal section with color Doppler. Continuous flow with blunted variations. Here we see comparison of spectral Doppler between the right side and the left side. Here in the left side we see the variations which occurs normally in the flow. Here in the left side we don't see such variations. This is a transverse sweep of the right side. We see echogenic blood here which denotes stagnation. This is a longitudinal section. We see this valve which is echogenic here because of stagnation of blood flow behind it. This is transverse section by convex probe. We see by comparison that the right is congested and the left is normal. Here we follow the internal jugular vein. We see here its confluence with the right subclavian vein. And here behind the right sternal clavicular joint we see a hypoechoic lesion just behind the confluence of the right internal jugular vein and the right subclavian vein, compressing it anteriorly. This is the aortic arc. By color Doppler we see flow from the internal jugular vein joining the right subclavian vein, and here is the flow in the right brachiocephalic vein, and this is the mass compressing it. So we have a mass lesion compressing the right brachiocephalic vein, seen by nearly coronal section at the suprasternal notch. This is the same view by cardiac probe. This is the flow in the left subclavian vein, and here the flow in the right. CT chest with contrast was done to study the lesion. This is the lesion. we see it compressing the right brachiocephalic vein here, filled with contrast.